Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome everyone. It's my great pleasure to be here with you. I'm Dr. Ahmed Sheikh. Welcome to the Saudi Patient Safety webinar. Today we have a very interesting topic and it's my pleasure to be with you with Dr. Khalid Al-Zahrani, our presenter today. The topic of today, disclosure of patient safety events, a very important topic for every single clinical practitioner from all aspects and perspectives. And it's a very demanding topic especially in the final era. It's my great pleasure to introduce Dr. Khalid Al-Zahrani, whose bio shows how he saw this topic in particular from different perspectives. As a surgeon, clinical leader, and a top management level, up to sharing in some strategic projects in Saudi that shape the quality and patient safety for the future. He's a practicing orthopedic surgeon consultant who holds Saudi board with honor in addition to fellowship in arthroplasty and arthroscopic surgery from the University of Toronto. He is a healthcare management leader, deputy director of Saudi Security Force Hospital Mecca, with long years of mixed experience as a clinical medical director, and he had the exposure to the managerial part of our topic today, seeing the cases from the mortality and morbidity side up to the legal level discussions of such cases. And finally, he's a true patient safety advocate with a background of diploma of patient safety and quality improvement from the Royal College of Physicians and Surgeons of Canada, who shared in writing of several strategic documents in Saudi Arabia related to the quality, the strategic quality, to mention some, the National Quality Strategy 2018-2023. Dr. Khalid, it's my pleasure to be here with you as the moderator. I'd like just to remind our participants that we are going to receive your questions. We will have two sessions for the questions and answers, one after 20 minutes from now and one by the end of the session. Please share your questions in the Q&A section. And if you have any issue related to the logistics part, feel free to write it in the chat. Dr. Khalid, the floor is yours. We are hoping for a very informative and knowledgeable session. Dr. Khalid.
Thank you very much, Dr. Ahmed, for this introduction. It's a pleasure for me to be with you and with the Saudi Patient Safety Center and this webinar discussing an important topic, in my opinion, and in my practice, which explaining the disclosure of patient safety events. So the objectives of this webinar will help us all to be able to differentiate between medical malpractice and complication, and it will help us all to start recognizing the magnitude of adverse event and the paths to resolution. And this also will help us all to know and explain how to handle medical event and prevent them. And realizing other perspective, which is very important in my opinion, which is the perspective of patient. How do they look to medical errors or adverse event? And finally, we'll just give you a stepwise fashion how to do an effective disclosure if there is any medical error or adverse event happening to the patient. So let me start with a case here, one of my own cases. She is a 65 years old lady with a bilateral knee osteoarthritis, and I have decided to do for her a bilateral total knee replacement. You can see that the X-ray here for me, it's a beautiful one, and it's showing that the alignment and everything went very well intraoperatively. She went through an early mobilization for the first day post-operatively, and she was doing fine until the third day post-operatively, where she started to develop a pulmonary embolism. So now I have a question for you, and it will be a poll question. Is this post-surgical event, the pulmonary embolism, a complication or medical error in your opinion? What do you think? So a bilateral total knee replacement. In the third day, she developed a pulmonary embolism. Is it a complication or medical error? Please vote. Okay, 87%, 78% say that it is complication, and the others 22, they said it's medical
22.
error. Yeah, 22, yes, 22%. So here we cannot decide, is it a complication or a medical error until we study the case very well. So if the patient received proper treatment, received the anticoagulant according to the guidelines and mobilized according to the guidelines, and everything was done properly for the patient, this could be an expected complication. However, if there is any mismatch or lack of treatment, like not giving the patient proper medication, not doing an assessment for the patient, not evaluating or mobilizing the patient as early as possible, in this case, we can consider it a medical error. So the decision of having something and consider it as a medical error or complication depend on the study of the case in proper way and making sure that everything was done for the patient according to the guidelines, and after that you can decide is it a complication or medical error. And this explains to all of us that there is a fine line to differentiate between medical error and malpractice, and this needs to be studied very well. So going to next slide. So when we go to healthcare practices, we know that there is multiple level of events that can happen. It can be related to negligence, it can be related to system failure, and it can be related to treatment complication or complication of the disease. So negligence can happen sometimes, and it can be simple, like delaying the medication for the patient, or it can be a major thing, like not giving the patient his medication, and after that he develops some complications related to that mismanagement. And this can be treated with just culture. System failure is another example that can cause significant harm to the patient. For example, if there is a mismatch or big mismatch between the policy and procedure and the actual practice, or if there is a miscommunication between different department or different team, this can cause a significant harm to the patient that can cause significant event. How can we manage this system failure? We can manage it using education for healthcare provider, doing the just culture or implementing the just culture, and improving the system and policy and procedures. Treatment complication is another thing that can happen sometimes to the patient. However, like the example or the case I present, it should be within the acceptable range. For example, if you have a cesarean section, there is a risk for infection post-cesarean section. And the international acceptable ratio is like 2%. If the rate of infection post-cesarean section is within the acceptable range, we can consider it as a complication. Or if the range is out of that, like 5% or 7%, we should study what's the reason behind that. And complication always happen if you are not considering a proper treatment for the patient. So mitigation the problem, like giving appropriate antibiotic, giving like a prophylaxis antibiotic can help you to prevent this expected complication. Complication related to a disease is another thing that happened to patients. For example, in polytrauma patients, we expect lots of complication. But this can be reduced by studying and assessing the patient in a proper way and trying to do an early diagnosis as early as possible to prevent complication from happening for the patient. How can we assess this type and differentiate it from complication and medical error? We can do education for our healthcare provider, do some bedside teaching and improvement of the system and policy and procedures and processes within the institution, and most importantly, having a data that help us to eliminate these problems. When we ask ourselves, are we practicing in a dangerous environment in healthcare? Yes, the healthcare is always dangerous. It's more dangerous than flying an airplane or working in a nuclear power plant, and is significantly dangerous more than mountain climbing. So we always should consider this and put this in our mind and be very careful when we are handling our patients. For example, to understand this, we should understand very well and study all patient safety related problem by doing mortality and morbidity assessment for our patient. One study shows that 1 in 10 patients develop a healthcare acquired condition such as infection, pressure ulcer, fall, and adverse drug event in hospitalized patients. So imagine this high rate and consider it in your daily practice. When we think about it in depth and study it very well, we will find that at least 50% of this event is preventable. Let's go for more data that is released by the WHO, and it showed the magnitude of the problem. The WHO data showed that about 421 million hospitalized patients every year across the world or globally. More than 42 million of them have adverse events occur to the patient during their hospitalization, which represent about 10% of those patients. The most common adverse events or adverse accident happening to those patients are related to surgical procedure in 27% of these cases, and medication error represent about 18% of these cases, and hospital-acquired infection represent 12% of these cases. This is reflected significantly in the economy of healthcare services, and in Europe, about 15% of hospital expenditure attributed to treating patient safety-related problems. More data also shows that there is a significant magnitude for medical errors and adverse event problems. Medical errors are the 3rd leading cause of death in the United States. You can imagine that how frequent is this problem. In UK, recent estimates show that they averagely report 1 incident every 35 seconds. In low and middle income countries, the rate is higher actually for the adverse event, and it represents about 8%. And of those 8%, 83% could have been prevented or preventable events. And of those 8%, 30% can lead to death. So the magnitude is significant, and we should consider this in our mind as a healthcare providers. In low and middle income countries, there is 1 death every 13 seconds related to medical errors. So here is a question for you, and I would like everyone to answer honestly. In your experience or in your past experience, did you commit a clinical error that affect patient? You can answer with yes or no. So in your previous practice, did you commit an error that reached patient? Please answer with yes or no. This is a disclosure actually. Wow, this is very interesting result. So only 37% disclose that they have committed a medical error that reached patient, and 63% say that they never have done it. Okay, this is very interesting result. So from my side, I would say that, what do you think? I have made a medical error that affects patient. I think anyone working in healthcare institutes have some mistakes sometimes. Maybe it reaches the patient, maybe it's not reaching the patient, but we always should reflect and consider our practice and know more about what we have done for our patient, and looking at things from the patient perspectives rather than from the physician and healthcare provider perspective. So what do we mean when we say a clinical error? It's defined as a failure of planned action to be completed as intended. So we have a plan and we fail to achieve it. Or if there is a wrong plan used to achieve an aim. So like misdiagnosis of the patient and giving him inappropriate treatment, this can lead to a significant harm to the patient. Unanticipated outcome that can result, or the result will be significantly different from what is anticipated. It can be related to omission, and omission is a very frequent problem, like something left undone, or neglecting patient, or neglecting a duty, or incomplete management and treatment for the patient. All these four elements can lead to a significant harm to our patient, and this should be considered in our daily practice. So a question here, what is the reason that patients will sue their doctors and nurses? What do you expect the reason behind that? A study showed that mostly in about 32%, it's usually coming as advice from others to sue the patient, and mostly it's related to inappropriate or inefficient communication between the patient and their healthcare provider. It could be related to belief from the patient that there was a cover-up in 24%, and it could be related to a reason that the patient need a money compensation. Most importantly, that most of the patients, in 24% or quarter of them, they believe that there is a cover-up. And when the patient is believing that there is a cover-up, this means that there is inappropriate or inefficient communication between the patient and his healthcare provider. We'll leave it now for Ahmed if you have some question, and then we'll go to the second part.
Thank you, Dr. Khalid, for being the early stage of the session. In fact, it was a very informative part. The issue is really hitting a very important, and it can happen to any caregiver. I believe in the first part, we covered that we are working in a dangerous environment. Whether we believe it or not, it's a dangerous environment. Yes, we have some errors, but these errors are 50% are preventable. If we say that we've been talking for 20 minutes, we can conclude from the presentation that we have lost, unfortunately, 91 lives. We had 91 deaths because we had one every 30 seconds, and 46 of these were preventable. These numbers are really catastrophic. I believe that the numbers, even the polls that we had, shows that yes, people can commit these errors, and the issue is what we're going to learn from the next part. How can we prevent it, and most importantly, how can we have some more questions, because we have only one question now from Dr. Amal Al-Anazi, which is the best attitude that we can find for a clinical error affect the patient, but the practitioner does not want to, I believe, to avoid. I believe this is going to be covered in the next part, so we can pass it to the next part directly.
Excellent. So please, if you have any question related to the previous part, you can post it in the question and answer section, and we'll try to answer all questions related to this webinar at the end of this presentation.
We just received on Dr. Khalid, if you wish to answer now, the question from Shaban Abdul Jalil. He asks, was there a cover-up because of fear of a malpractice lawsuit?
Oh, this is an excellent question, actually. This is a common problem, actually, because the healthcare provider always having some fears that if there is event or accident or an error, they will be like, go to the lawsuit. So let me think about it from my side. If you have a problem or a medical error and you cover it up, This might be discovered one day and it will be a big problem, or the magnitude and the consequences of this cover-up can be significant for anyone. But if you discover it early and try to make a setting for the patient and try to disclose it with the patient and discuss it and explain it, believe me, it will be very helpful for both of you, the healthcare provider and the patient himself. Patient mostly, in most of occasions, they will understand, and we will go over the disclosure process and how it can help you as a healthcare provider to make a better communication with the patient and eliminate or relieve this tension between both sides. That's a good question, actually.
And I believe we have a follow-up question from Ms. Hayat Magrashi. Is it a belief that it is a cover-up or lack of trust?
I think it's.
I believe between the practitioner and the patient.
You mean is it like a cover-up or
yes,
miscommunication?
Because Dr. Khalid, you mentioned it is a miscommunication. So here she elaborates on, or maybe it's a lack of trust with the caregiver.
Let me take it backward, actually. Patient, when he comes to the hospital, always they have some expectation. So once you have a proper communication with the patient and explaining to him the expectations and explaining to him the expected outcome and the risk that he might have, this will eliminate all this process. So when the patient feels that there is a cover-up, means that there is lack of communication between the healthcare provider and the patient. So if the patient observe or have some complication related to his problem, and you are not addressing him from his perspective and explaining to him the event, what happened, and explaining to him, is this a mistake or this is expected outcome? So in this gray area, always the problems will come. So the patient will think about cover-up when there is no proper communication between him and his healthcare provider.
Thank you. So the rest of questions, I believe, will be covered in the coming part.
Yeah, believe me, more than 87% of the problems in the lawsuit is related to communication problem. Most of it can be addressed or could be addressed before reaching there. Yes.
Yes. So I believe the rest of questions are focusing on the how to prevent the errors and how can we approach the family, and this is our second part, inshallah.
Excellent. Yes, this is what we'll talk about. So in this slide, they have a question for every one of you. What is the number in the red circle? Is it 6 or 9? So we need your answers, please. So there is a number here, you can see it in this red circle. So is it 6 or 9? Oh, excellent. So 70% say it's 6 and 30% say it's 9. So actually, don't think that this is a silly question, because always there is a two sides of story. The guy in the right side can see it as a 6, and the guy in the other side can see it as a 9. This different perspective or different understanding for things can happen between the healthcare provider and patient. When you are looking for things from your angle and ignoring the perspective of patient, this miscommunication can happen. However, when you are putting a clear line or explaining to the patient in a proper way about everything, the patient will understand more and he will be engaged more, and he will have a better expectation of his outcome. So consider the perspective of patient always when you are handling any event. And this is the opening for our disclosure process. How can we disclose an event to our patient? Always there is one accident and there is two perspectives. So there is a perspective of the healthcare provider, which could be different from the patient perspective. And this actually important to be considered. When you are talking about the definition of error from a healthcare perspective, always we consider it a narrow definition. So we always think about things that this is not a medical error, this is a complication. However, the definition from the patient perspective is always broad, and they consider any deviation in the process can be a medical error or malpractice. So always think with the brain of the patient and see with the eye of the patient. When to have a conversation, when to discuss what happened to the patient. Physician and healthcare provider always think that they will have this conversation when they have all data, all facts, and this may take time. However, from the patient perspective, we always want information to be delivered to him immediately. And this is his vision and perspective. So we always need to communicate with the patient frequently and explain to him gradually what is the problem and disclose it to them in a proper way. And we'll explain how to disclose any medical error or events to the patient. About the exposure and disclosure, from the healthcare provider perspective and the physician perspective, they always think that they only will disclose the error that caused significant harm to the patient. However, from the patient perspective, they always need to disclose all errors, even those that near miss or not reaching the patient. So these things are very important when we are considering disclosure and explaining to the patient what happened to them. And there is a significant disclosure gap, and many studies shows that in healthcare, few of providers believe that they do mistake. We always trusting ourselves. We always think that we were taught properly, and we are confident that what we are doing for our patient is in a proper way. However, we should always reflect and consider that there might be mistakes that need to be addressed and considered and discussed with the patient. One study shows that more than 90% of healthcare providers support the principle of disclosure. However, only 30% of them actually doing this disclosure or practicing disclosure. And this takes us to the importance of disclosure. Disclosure can disclose a simple thing that happened to the patient or a major thing that happened to the patient. However, there is some condition, we'll discuss it, how to disclose things and how to explain it to the patient. When we think about the reason, what is the common reason that make us doing underreporting or not disclosing to the patient? What do you think the reasons, in your opinion? As discussed earlier, mostly the healthcare provider may be afraid to disclose things to the patient, and they may say, if I disclose to this event to my patient, he might take me to the lawsuit, or he might complain against me. Others, they thought that they are so busy to disclose to the patient. And I would say that this is not true, because patient is the center of care, and patient is the one we are all circling around him and trying to provide the service for him. He is the customer of our service. So we should give him some time and disclose and explain to him what happened to him. Other healthcare providers, they think that they don't know that this is an incident or mistake. So if you are in doubt, you can consult an expert. You can ask for help from a colleague that you trust, and make sure that what happened is expected complication or an accident or event that need to be disclosed to the patient. Even if it is a complication, and it needs to be addressed, and it needs to be explained to the patient that this is expected complication of your natural disease. Other healthcare providers, they thought that someone else will do it for him, and maybe they will wait for them to do it. Actually, if you have this problem, you should ask for help and ask for someone to support you to disclose and explain this event and report it to the patient. Some people, they are saying or thinking that reporting or disclosing is of little value. It is not actually, because reporting is very important to manage the risk and to assess the risk, and it helps us to learn from this mistake and prevent it from happening in the future. And disclosure is important for the patient so he can share with you the decision, what to do next, and how can he handle this problem. So these are the most common reasons that why healthcare provider is not reporting or not disclosing events to patients. There are many benefits of disclosure, and the first benefit is to reduce the risk of litigation and the consequences related to complications or medical error. And the other benefit, it's better for both patient and clinician. And why we are saying it's better? Because it will help you and the patient to be in the same page, to have the same information, and any events that happen can be discussed in an open way, and it can be managed in a proper way. And at the end, the patient will understand with you, and he will help you, and you will help him to achieve a better outcome. And a study has been done by University of Michigan shows that there is a significant impact of and improvement when they implement a full disclosure policy between 2001 and 2005. It helped them to reduce annual litigation cost from 3 million to 1 million. And it helped them to reduce the average time to resolution of claim from 20 months to 9 months. And also it helped the University of Michigan to reduce the number of annual claims from 262 to 114. More than half of claims were eliminated after and following full disclosure policy. And this disclosure needs to be implemented in the institute, and people working in that institute should be trained for it to implement it in a proper way. We'll have a quick overview about the steps. How can we disclose an event? And this is very important, and we will take it in a simplest format and a simple way. When you have an event or an error or a complication reaching your patient, it should be disclosed in this stepwise fashion. The first step is from your side to prepare yourself and make a check-in process. The second step is to state what happened simply to your patient. The third thing is to apologize for the patient. The fourth step is to take responsibility for any event happened to your patient. The fifth step is to make an assurance, assure your patient and help him to solve the problem. And following that, you should invite question and ask and help patient to ask some question if he has, and make a follow-up plan together with your patient. All these steps should be documented in patient medical record, and after that, you should utilize it for learning improvement by doing debriefing with your patient and with your partners. So let's take it one by one, step by step. What do we mean for preparation? So if you have a problem or event, you have to prepare yourself. You can ask for help. You can ask a help from expert or colleague or a team member that will help you to prepare for the setting and for disclosure of the patient. So this is the first step. Prepare yourself for disclosure. Make your mind open for disclosure to your patient. And you can seek assistance. Always ask for assistance from expert, trustable colleague. Who will help you to make this process easier and give you some ideas how can you approach your patient. And before going to your patient, prepare yourself with all available medical facts and data that will help you to explain to the patient in a proper way. The most important thing, prepare a good setting and environment for disclosure. So you should disclose in a setting or environment that the patient will understand, he will be calm. You can make a meeting room, you can make it in a meeting room, or you can make it in the bedside, but prepare the setting and the environment in a proper way. So this is the first step when you want to disclose anything to your patient. Prepare yourself very well according to these steps. The second thing, when you are going to the patient and trying to explain to him about any event, just state simply and slowly what happened. The patient cannot understand medical terminology, so make yourself ready using a simple words that help you to explain to the patient what happened and state to him how can you help him and what was the problem related to this event. So use simple words, make it slow, and avoid any terminology. After that, simply focus on the patient welfare. Don't focus on yourself. Don't be afraid. Okay? You have to have the courage to talk to the patient and simply tell him, I am sorry, this was happened, and we should consider the patient perspective. So apologizing for patient is very important to reach the patient mind and to engage him in the process. So simply when you are apologizing to your patient and make it in a simple words and taking the patient welfare in consideration and the patient perspective in consideration will make the patient open his mind for you to explain to him what happened. Then you should take responsibility. You and the team with you should take the responsibility and use I statement or we statement when you have a problem related to the patient or adverse event that impact patient. And do not blame others or blame systems or say that I'm too busy. Just simply take the responsibility, because once the patient feels that you are responsible, he will trust you. And this take us back to the question of the trust. If you are showing the patient that you are responsible, he will trust you, that you can help him to overcome this problem. After that, you have to make the patient confident about what you will do. Give him an assurance and explain to him, what is your plan? How can you help him? And this should be explained thoroughly to the patient and giving him this information in a proper way, in a simple way, and avoid using any terminology, and give him a plan. The plan will help the patient to trust you and to know what is coming up. And always when you are making the plan, give the patient some expectation, what you are expecting as an outcome of this process. So this will help the patient to get more confident in you and to trust you more, and he can help you to implement your plan in the future. And don't forget to invite questions. Once you finished your plan and explain to the patient everything, and you tell him what you will do to overcome this problem or to resolve this problem, ask the patient if he has any questions. Mostly they will have lots of questions about this problem, about this event, and this will help you to wrap the gap, and the patient will have the opportunity to ask anything in his mind, and you should explain to him very well in a proper way and in a simple format his question and answer him properly, because these questions might help you also as a healthcare provider to improve the outcome and to make the plan very well clear for you and for the patient. So don't leave the patient with unanswered question. Invite question and ask the patient if he has anything in his mind that is not clear. Ask him if there is any information that he cannot get it or cannot grasp it or cannot understand it, and explain it to him in a different way. After that, make sure that you have a follow-up plan. A follow-up plan will always help you to improve the trust between you and your patient. The plan, what's the next step? What you will do after that? If the patient will go home, how can he access you or reach you in the hospital? So the patient must have a good access to care at all time if there is a problem, or if there is no improvement, or if there is unexpected outcome. So please help your patient and make a plan with him and give him a good access to the service at any time. Documentation is very important things. Once you finished everything and explain to the patient everything from your perspective and answer his question from his perspective, you have to make a documentation for all this disclosure in patient medical record. Documentation is very important as a reference for you and as a reference for the patient, and this will help you to mitigate the problem and consequences in the future. The final step is to do a debriefing with the patient and debriefing with your team. Okay, so back to the beginning and debrief the patient about what you have discussed with him, what is the plan, what is the next step, going from the first step and debrief everything with your patient. After finishing this, debriefing with the patient and summarizing all points to your patient, you can go and debrief with your colleague. And this is very important actually to debrief with the disclosure with your colleague because it's learning opportunity. This will help you and help your team to improve your performance in the future. You can always reflect on what happened, and this reflection will help you always to improve your performance and your practice and prevent this from happening in the future. In a summary, as we discussed, there is a fine line that discriminates between the medical malpractice and medical complication. Medical errors are happening daily in healthcare practice. And as you notice in our first section of the presentation, that there is a significant number of patients get harmed while we are giving them our care in the hospitals. More than 10% of population or hospitalized population, they are getting some harms. Some of it did not reach or near miss harms, and some of it have significant impact on patient health. And always consider that there is two sides of the story. Don't think or look at things from your perspective. Consider the patient perspective. Consider the patient expectation. Ask patient if he has any question or he needs any explanation for any outcome that related to his medical management. And as we noticed, that disclosure will help to minimize any consequences related to healthcare management or hospitalization of the patient. Always consider that disclosure is very important. Even if a simple thing happened to the patient, it should be disclosed. Major things should be disclosed in a stepwise fashion and documented in patient medical record. Finally, effective communication that consider the patient perspective is vital to mitigate errors, magnitude, and help patient to understand you and build the trust between the healthcare provider and patients. This is a summary of our whole presentation, and please, if you have any question, we'll handle it now to Ahmed to debrief about what we have mentioned about disclosure, and then we'll see some of your question and answer it. You are muted, Ahmed.
Thank you, Dr. Khalid. Thank you so much. I believe we have at least a dozen of questions so far, and I believe we're going to receive more. And most are related to the disclosure part and handling of this, and how can we enhance it. The 9 steps that you provided by the end of the session is really a stepwise fashion that I believe that is going to help, whether the case is small or a large case. Yes, I believe this is the landing slide that we may focus on, starting from the preparation, checking in, and a clear statement of what happened, and then the apology. You have a question about the apology, the responsibility, the assurance, inviting the question, not only giving the answers without giving the chance to give the questions, the follow-up, the document, and the debrief. Allow me to start from the latest part of the summary with a question from our dear Mr. Ahmed Al-Hatlan, and he asked about the communication, the effective communication. If there is a tool for effective communication, how can we implement it in an integrated system? He defined the integrated system in the question as internal, external, horizontal, and vertical communication system.
Okay, that's a big question actually, because disclosure is one tool of communication. So when we are talking about the communication, let me take it to the simplest way. So let me ask myself, do I explain to the patient in a proper way every expectation or every expected outcome from any intervention? That's a big question actually, because we are working in a very busy practice. Sometimes the healthcare provider might not give a proper or enough time for his patient to explain to him everything and explain to him any expected outcome related to his practice. So I would say that we should always consider that the patient have the right to receive all information related to his medical care in the hospital. This is the patient right, actually. When we are talking about the horizontal and vertical, I think he means that when we are talking to the patient and to other healthcare provider, so communication should be in a simplest format with the patient and explaining to him the expected outcome and asking the patient from his side, what do he expect as an outcome from this like intervention or this procedure or whatever. So when you are hearing from the patient and giving him all the information and giving him the opportunity to ask all relevant questions from his perspective, this will enhance the understanding and it will increase the trust between the patient and his healthcare provider.
Thank you so much, Dr. Khalid.
I answered this complex question.
Yes, it's very clear, I believe. So a repeated question regarding why shall we disclose an error or that didn't cause a harm to the patient? So if there is no patient harm, why shall we disclose this to the patient?
So what do you think the reason? Why should we disclose it? This is a good question, actually.
Yes.
So disclosure here, what we mean that any event that happened to the patient or affect patient, this is the important disclosure that should be disclosed to the patient and documented in his medical record. This is by definition, okay? But if there is any problem that not reaching the patient, I don't think that it's mandatory to disclose it to the patient. And maybe we will use it as a learning opportunity for our team or for our staff to avoid it in the future from happening. So when we are talking about disclosure, we always consider things that reach patient or affect patients.
Yes, that's great. So a repeated question. Okay, so how to handle the, if we can call it the ignorance or the tendency not to apologize, that is maybe a trait of some caregivers.
I can't hear you, Ahmed.
Or Doctor, can you hear me now? Dr. Khalid, can you hear me?
So I think Ahmed means that if
Dr. Khalid, can you hear me now? Dr. Khalid, you are muted.
Okay, what was the question? Ignorance.
Okay, the question. Yes, ignorance or the tendency not to apologize. Maybe this is a trait of the physician or maybe because of the culture. So how can we handle this?
So I will ask a question now. Why not to apologize to the patient if you have some harm to the patient? Okay, so why not? So it's a simple thing we should, maybe it's cultural, but I would say that it's important thing that you should explain to the patient and giving him apology for what happened to him. This is actually very helpful once the patient feels that you are apologizing and explaining to him in a proper way and considering this event as something major that you need to apologize for. This will build up the trust between the healthcare provider and his patient. I think the apology is a mandatory thing if you did something to the patient, and it should be presented in a simple way. So what's the harm to say, I'm sorry that we have done this and this and this, and we can help you by doing 1, 2, 3. What do you think, Ahmed?
Okay. Yeah, I believe this covers this part very clear. We have another question here related to, okay, so if the patient, if this is related to patient death, does it differ from other event that only caused harm? This is from Dr. Fawzia Shamrani.
So you mean the harm reached the patient and caused death?
Death. So the disclosure here will be to the family.
So now here, in this case, the disclosure should be delivered to the family. And it's important point. Sometimes if you are making a setting for patient disclosure, you might ask the patient if you need someone with him to support him, to help him. Maybe the patient will say, I want this disclosure to be delivered in front of my like son or my kin or whoever. So patients have the right, if you will disclose something to him, he might ask for someone to be with him. But for those who have a harm that caused death, this is a significant issue, and this disclosure should be documented in the medical file, and it should be disclosed to the family.
Thank you, Dr. Khalid. A very good question is, okay, so again, related to the relatives, but from your practice, how can we handle those relatives that are the one who was mentioned in the slide that are pushing the patient to sue the physician?
This is a very important question, yes. So in my practice, actually, I always try to find one only of the relative who should be representative of the family or the relative for the patient. I'm trying my best to do this, although it's difficult to implement or to apply in all times, but always have some like anchor person who can be or who will be the one can talk to you and can represent your transfer the knowledge or the information to his family. Because if you are talking to too many people, this will waste your time. They might have different understanding, and this can cause some miscommunication. So I'm always in my practice trying to ask if they are a big family and many relatives, I will ask for only one person to be a representative for them. And for this person, I will deliver all the information and he can deliver it to others. That's what I'm doing, actually. I'm trying my best to do this.
Thank you so much. So one question regarding who should disclose, the treating physician or the MRP?
Okay, I would say the disclosure is a process that should be delivered with the MRP. It's the responsibility of MRP. And if this like event or accident related to multiple persons, they should come as a team and disclose as a group, because some events can be like miscommunication between different parties of the team, and this causes harm of the patient for at the end. When I'm doing disclosure for any patient, I always invite someone with me. I'm always asking for my assistants or for my colleague to join me, and using them just to help the patient to feel more confident, and they might help me also to add some important information that I will miss at the time of disclosure. So I would say disclosure is always not one person process. It can be done as a team, and this team should be selected properly. As we mentioned in the preparation, you can ask for a trustable person who can be with you at the disclosure time.
Thank you so much, Dr. Khalid. As I mentioned very early in the biography, that you've seen this process from several perspectives. And we have here a final question from Ms. Makia Magrashi about the disclosure, need change management, and leadership support. So what's your advice to the leaders to encourage this process?
Okay, that's, I think, one of the most important questions. Thank you for asking this question, actually. The disclosure, actually, it's a process. It needs implementation. And before doing the implementation, it needs a policy and procedure that will help the institute to train people working in that institute and enhance and encourage the process of disclosure. So I agree totally with this question that it cannot be done by individual alone. And if you want to improve the process, it needs to be based on a system. The system should be supported by policy, procedures, and this policy and procedures should be reflected as a training process for all healthcare providers, encouraging them to disclose to the patient, doing some workshops for them to try to do it actually with their colleague, and doing some, let's say, exercises, how to disclose if you have a problem. So I think it's a system problem, should be supported by the any hospital administration or hospital authority, and should be in a structural format. As I showed in the example of Michigan institution, once you apply it as a system-based process, it will be reflected positively on the institution and on the healthcare provider individually.
Thank you so much, Dr. Khalid. If you allow me to add one last point to this, is maybe training, because maybe people do not do because they don't know how to do. And this is exactly what we tried to make here. I've really, myself, I should make a confess here that I really enjoyed the presentation, and it was really informative from my side. We have some other questions, but unfortunately, time is up for the session today. Thank you so much, Dr. Khalid, for the very informative presentation. I believe that you provided a very good way or a strategy to do the disclosure, when and how and who. Hopefully this is going to help, and this is going to benefit for the, not only for every individual practice, but collectively for the whole patient safety all across the world. Thank you so much. We hope that you enjoyed our webinar today. Thank you so much, Dr. Khalid.
Shukran, thank you very much. It was a pleasure to be with you today, and thank you for Patient Safety Center for giving us this opportunity to discuss this important topic, and hopefully we'll be with you again in another webinar. Thank you very much.
Inshallah, my great pleasure as always, and thank you so much. See you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullahi.